Welcome back to Med Madness, your go-to podcast for in-depth medical insights. Today, we're diving into a critical topic, infections during pregnancy. We'll explore how certain infections can impact both the mother and fetus, examining their pathogenesis, clinical features, and management strategies. By understanding these infections, we can better appreciate the importance of preventive measures and timely diagnosis. Let's begin with Congenital Cytomegalovirus, or CMV, a common congenital infection. CMV can be transmitted transplacentally during maternal infection, often resulting from close contact with young children. During this maternal infection, the virus can spread throughout the fetus, particularly targeting the placenta, liver, and central nervous system. This leads to significant clinical features detectable via ultrasound, such as periventricular calcifications, ventriculomegaly, microcephaly, intrahepatic calcifications, fetal growth restriction, and even hydrops fetalis. Neonates with congenital CMV may present with petechiae, hepatosplenomegaly, chorioretinitis, and microcephaly. Long-term sequelae can include sensorineural hearing loss, seizures, and developmental delays. Diagnosing maternal infection typically involves serology, while fetal infection is confirmed through amniocentesis. Unfortunately, there's no proven maternal antiviral therapy to prevent fetal infection, making management largely expectant, with consideration of pregnancy termination in severe cases identified early. Next, we turn to Parvovirus B19. This infection can have devastating fetal consequences due to its cytotoxic effects on fetal erythrocyte precursors, leading to severe anemia. The fetal heart compensates by increasing cardiac output, which can ultimately result in high-output heart failure and hydrops fetalis. Ultrasound findings often reveal signs of fetal anemia and hydrops fetalis, characterized by pleural effusion and ascites. Diagnosis involves maternal serology and fetal ultrasound, with management including serial ultrasounds and potential early delivery for severely affected fetuses. Another significant infection is Listeria Monocytogenes, commonly contracted through contaminated food such as deli meats and unpasteurized dairy. This bacterium can invade the intestinal mucosa, leading to gastroenteritis in healthy individuals. However, in pregnant women, Listeria poses a much greater risk, potentially causing transplacental infection and intrauterine fetal demise. Clinical features in these cases can range from febrile gastroenteritis to invasive diseases such as sepsis and meningitis in neonates, pregnant women, and immunocompromised individuals. Diagnosing Listeria infection involves culturing samples for gram-positive rods, and treatment varies from supportive care in mild cases to parenteral antibiotics for invasive disease. It's crucial to distinguish these infections from others that may present similarly. For example, influenza is not vertically transmitted and does not cause fetal anomalies. Parvovirus B19 typically leads to fetal anemia and hydrops fetalis without intracranial or intrahepatic calcifications. Congenital rubella syndrome can cause fetal growth restriction and hepatomegaly, but vaccination status usually provides immunity. Lastly, congenital syphilis from Treponema pallidum can cause fetal calcifications, but a confirmatory treponemal antibody absorption test can rule this out. Let's look at a real-life case to bring these points home. A 28-year-old pregnant woman, Lisa, presented with flu-like symptoms in her second trimester. She had been in close contact with her young nephew, who attended daycare. Ultrasound examination of the fetus revealed periventricular and intrahepatic calcifications, ventriculomegaly, and microcephaly. Further testing confirmed congenital CMV infection. Lisa's serology was positive for CMV, and amniocentesis confirmed fetal infection. Though the news was devastating, understanding the infection's nature helped Lisa and her healthcare team make informed decisions. Despite the challenges, Lisa received supportive care and closely monitored her pregnancy, ultimately delivering a baby who, though born with CMV-related complications, received early intervention and care. Understanding infections during pregnancy, like CMV, Parvovirus B19, and Listeria Monocytogenes, highlights the critical need for prevention, timely diagnosis, and appropriate management to mitigate their impacts on both mother and fetus. Always consult your healthcare provider if you suspect an infection or have concerns during pregnancy. Stay tuned to Med Madness for more insightful discussions on essential medical topics. Until next time, stay informed and stay healthy.